Allora, Gai, così parlando col mio gruppo, confrontandomi col mio gruppo, abbiamo pensato di chiederti questa cosa, perché si pensa che ogni modello sia indicato per un certo tipo di disturbo, per una popolazione, una certa parte di popolazione. E ci chiedevamo ABFT per quale popolazione è indicato, per quale tipo di disturbo è indicato e dove può essere applicato.
So we're often asked at trainings particularly if you can use ABFT with different kinds of populations, different clinical populations, different age groups. And most of our work in the early days really focused on youth presenting with suicide and depression. But anybody that works with that population knows those kids, 30% of those kids have a history of sexual abuse, 30 to 40% of those kids present as LGBTQ. 80% of those kids in our last study had comorbid for anxiety disorder. So these are complex kids. These are suicide's just a flag for a kid who's in distress. But there's also been questions of, could we do it with an autistic kid? Could we do it with younger kids and with older young adults? And we've actually started to do that kind of research as well. There's a group in Belgium who's modified the work for 8 to 12-year-olds using a lot more play therapy and games and puppets, but really using the same sort of scaffold of the 5 tasks to generate those kinds of attachment themes early on in therapy. There's been a lot of work with young adults. Gary Diamond's work with the LGBTQ community. We're doing a big study now. In Belgium, I mentioned earlier, we work with a large residential treatment program that has a very big young adult program, and it's being used there where there's a little more attention to autonomy promoting. It's not so much kids want a 20-year-old isn't so motivated about being close to their parents again. They're out of the house and, but they are interested in working through the ghosts that still haunt them about their family relationships and feeling more free to be launched and move forward. So we've definitely done a lot of work, systematic research work with different populations, different disorders. But the thing I'd say mostly that's important is that ABFT has a transdiagnostic nature to it. We are trying to improve the secure base of family life. Better parenting, better parental teamwork, better communication from a kid, more trust. And that shows up with kids who have chronic medical illnesses, who have ADHD, who have autism. And we find that some of the targets of ABFT sort of reach across a number of families that present for mental health. They've been under stress, they've been under duress, there's lots of family trauma. And ABFT can be used in a sensitive way to modify for a variety of populations. And so in that regard, we see it as a pretty flexible model that can be applied or used as a general structure with most families that walk in the door.